much. I had a long ride up here from Rhode Island this morning, so some time to reflect on where I've been and how I came here, and thought back on a conversation some 20 years ago with Cheryl Rivers over at the State House, in which I think I threw up my hands in exasperation and said, you know, Cheryl, just once I would love to be on your side of the table arguing for single payer, because it makes sense, you know, and we all agree on that, but how do you get from here to there? And so now that's my job, is to figure out how we get from here to there. And I'm really excited and honored to be in this position. In the 20 years since having that conversation with Cheryl, I've learned a lot about healthcare reform. I've done a lot of work on healthcare reform as part of the Clinton team and as part of Howard Dean's team, and now as a consultant for states and foundations. And I think what I've learned in those intervening 20 years is that you can do a lot of good progressive policy work at the state level, but the impact is fairly marginal, and we really need to do something that's dramatically different if we're going to provide coverage for everybody and make sure that the cost is sustainable. So I look forward to working on this. I'm honored to have been asked. I'm excited about working with this team and all the other people inside and outside of state government who will be necessary to pull this off. It will be an extraordinary team effort, but I think we can do it. I think we can craft something for Vermont that makes sense. I think we can craft something that's saleable to the feds, and I think we can develop a model for other states. So thank you for asking me to do this. Thank you for sticking your neck out where no other governor would go. And I look forward to working with you.
Thanks. Steve?